Hey guys, it's Justin from LitTube. This is another face-to-face video, and it's March 6th of 2017. We have some important news. The GOP has revealed their plan to repeal and replace Obamacare. And I'm going to give you the details on the bill that they have drawn up and are going to propose to Congress. I'm going to give you the full coverage on that right now.
The GOP has proposed the American Health Care Act as their way to repeal and replace the Affordable Care Act, aka Obamacare. Here are some highlights on the American Health Care Act. So, one of the main things this does is it gives individuals in the United States tax credits towards health care, which is based primarily on age group. So, for example, people that are in their 20s are going to get a tax credit back around $2,000 each year. And that tax credit goes up to $4,000 for people over 60 years of age. So you're getting a certain amount of taxes back, uh, I guess in the form of a tax refund based on what your age is. So if you're older, you're getting more of a refund towards healthcare expenses. Now, there's also an income component to this as well. Your tax credit is reduced if you make over $75,000 a year as an individual, and your tax credit is phased out entirely for individuals earning $215,000 or more per year. So if you're rich enough that you're making more than $215K a year, you're not going to get a tax credit. Another thing that the American Health Care Act does is it rolls back the number of citizens that are covered by Medicare. So that's definitely a bad feature of it, but I suppose they figured that's maybe one of the ways to reduce the cost of the plan. Another thing that the American Health Care Act does is that it removes individual and employer mandates that were in place under Obamacare. This means no penalty or fine for not having health insurance, and that's definitely a piece of this legislation that I like. I really think that it made no sense to fine someone for not having insurance because I viewed that as an invasion of your rights. That's basically the government telling you you have to go out and buy a product or service, in this case, being health insurance. So I did not like that, and they got rid of it. I approve of that piece of the legislation. Now, another thing that the American Health Care Act does is that it supposedly allows individuals to obtain insurance even if they have pre-existing conditions. That is something that was in place under the Affordable Care Act. It also allows children to stay on their parents' health insurance plans until age 26. Another similarity to Obamacare that was kept in this piece of legislation. Now, what's unclear about the American Health Care Act in particular is the cost, what the total cost is going to be to the taxpayer to implement this plan. And in addition, how many individuals will gain or lose health insurance as a result of the proposed changes in this plan compared to what we already had in place with the Affordable Care Act. Now, this bill is expected to be voted on in late March of 2017. And it's already drawing criticisms the day it's been proposed. On both sides of the aisle, actually. Democratic Senator Chuck Schumer said this plan will cut and cap Medicaid, defund Planned Parenthood, and force older Americans to pay more out of pocket for medical care. Republican Senator Rand Paul called the plan Obamacare Light and took issue with billions being offered in refundable tax credits. And I'm assuming he's taking issue with that because, that's one more budget item, right? If the government's giving us all tax credits back, I guess that's adding to the debt and the deficit. So I'm assuming that's what his issue is with that it's basically like too expensive for the government to implement. But those are the criticisms, for different reasons. One more cost-based, the other one more not liking the fact that Medicare is getting shrunk down and that Planned Parenthood's getting defunded. But those are the criticisms on both sides of the aisle, Chuck Schumer and Rand Paul, Democrat and Republican respectively. My take on this I mean, I think we still have to wait for the full details to get, revealed. In my opinion, there's still some unknowns here. We're just getting some of the basic facts right now, and I think we got to see like the full facts before we make any extreme judgments one way or the other. But all that said, I mean, I do like how they're going to take away that mandate for the employers and the individuals, forcing them to have health insurance and get fined otherwise. I don't like that. You should not be able to force anyone in this country to buy a product or service. I believe that goes against your rights to do that as an American citizen. That goes against your freedoms. But at the same time, this is kind of a half-assed plan, just like Obamacare was, in my opinion. Now, what do I mean exactly when I say that these are both half-assed plans in regards to the American Health Care Act that's just been proposed and the Affordable Care Act, Obamacare, that we've had over the past several years? Well, when I say half-assed, I'm kind of just looking at it from the perspective that they seem at like centrist policies. They don't lean too far in one direction or the other on the political spectrum, because I feel like if you have like more of a right-wing conservative proposal, that would be more like what Ted Cruz was talking about in the debate with Bernie Sanders. Basically leaving it up to the insurance companies and free market principles, and just getting the government out of your healthcare entirely, like not having having the government really do anything with the healthcare, and just make it private industry and remove the lines between the states to increase competition. And then on the far other side, on the left side of the political spectrum, what's the big plan seems to be what Bernie was talking about, where you basically have Medicare, Medicaid cover everybody. So it's an expansion so that government makes sure that everyone's covered in a single payer system by the taxpayers. So it would raise taxes, but everyone would be guaranteed healthcare coverage. For those of you that have followed my other video where I broke down that debate between Ted Cruz and Bernie Sanders, you know that I believe the best plan for the United States is the single payer system for a variety of reasons. But at the end of the day, whether you are a fan of free markets handling healthcare in the United States, or you're a fan of government expansion and covering everybody, I have to say, like, these plans in the middle are kind of frustrating to people on both sides of the debate, because it's kind of like no one's totally satisfied with this. I mean, I guess it's okay that and I'm in my 20s, so I'd be getting around $2,000 a year in tax credits, tax refunds, I guess, under this American Health Care Act. But I'm still kind of confused, like how they're going to guarantee coverage to those with pre-existing conditions under this plan. Because with Obamacare it's pretty straightforward, but with this, the pre-existing condition question, I mean, like, how are they going to force those private companies to give insurance at a reasonable rate to those with pre-existing conditions? I don't know how they're going to do it. Interested in hearing that, but like all in all, this doesn't seem that different from Obamacare, really. Like, I kind of agree with Rand Paul. It seems like Obamacare light, and it's just basically a different way. Like, you're getting tax credits instead of just you paying for a certain amount for health insurance. So anyways, that's going to do it for this video. Make sure you click that subscribe button. We want you to get the constant updates on LitTube, where you got continuing coverage on politics, sports, a whole range of topics on this channel. I mean, just check out our playlists, fabulous stuff on this channel. But if you're particularly interested in the politics, I mean, we cover it on Face2Face, we cover it on Couchside. I have the flyer up on the screen. Make sure you go ahead and like our Facebook page, follow us on Twitter, follow all the fun, and hope to keep bringing you updates like this as we get more information about this new plan that's been proposed.